Welcome to Medical Lectures channel. We are going to continue with tooth morphology introduction. Today we are going to cover these topics such as tooth surfaces, what is cusp, tubercle, cingulum and mamelons. Starting with our first topic, which is tooth surfaces. Anterior teeth have their own surfaces and posterior teeth have their own surfaces, right? So anterior teeth, all anterior teeth have 4 surfaces and 1 incisal edge. Mesial surface, the surface which is towards the midline. Distal, the surface which is away from the midline. Labial surface, the surface of the tooth which is towards the lip. Lingual surface, the inside surface of the tooth which is towards the tongue. Incisal edge is known as biting edge. Now in tooth morphology's book, which is known as filler, there is a term which is known as proximal. Proximal word is usually used for both mesial and distal surfaces. What is cusp? Cusp is elevated and usually pointed projection of different size and shape present on the crown of a tooth. They are not present in the root. Tooth has 2 portions, one is crown and one is root. So cusp, they are present in the crown. They are usually pointed projections of different size and shape. They form the bulk of the occlusal surfaces of posterior teeth and incisal portion of canine. Incisors, they do not have any cusp. They have incisal edge. Canine has only 1 cusp. Premolar have 2 or 3 cusp, and molars usually have 4 or more than 4 cusp. What is tubercle? A rounded or pointed projection found on the crown of tooth. They are of various size and shape but are usually smaller than the cusp. Tubercle are very similar to cusp. They are also pointed projections. They are also present in different size and shape just like cusp, but the only difference is their size. Tubercle are smaller in size as compared to the cusp. Their tubercles are also considered as mini cusp. The cusp of carabali is a tubercle present on the mesial part of lingual surface of permanent maxillary first molar. In order to identify permanent maxillary first molar, one should look for cusp of carabali, which is a tubercle present on the mesial part of lingual surface. What is cingulum? A large rounded eminence present on the lingual surface of all permanent and deciduous anterior teeth. It is usually present in the cervical third of the lingual surfaces. What are mamelons? They are small rounded projections of enamel which are found in different size and numbers on the incisal ridges of recently erupted incisors. They are usually worn away after eruption when the tooth contacts the antagonist in the opposite arch, especially when the teeth are in function.